Well, we've looked at trade, we've looked at housing, we've looked at education. Now we're going to move on to another very topical area where a lot of ideas need to be challenged, and that's health policy. It falls to me now to introduce another of my colleagues, Kate Andrews. Kate is a citizen of the US. For a while, she seemed to be getting a phone call pretty much every day from the BBC or other media wanting her to explain what on earth was going on in the American presidential election, but now that's, fortunately for her, maybe not for the rest of us, in the past, so she can concentrate on her other job, which is running our digital management and news strategy. But she's also got a talk she's given to many audiences so far about healthcare policy and about the kind of lessons that we can learn from other parts of the world, and that's what she's going to talk about now to you. So thank you very much, Kate.
Thanks very much, Steve. Thanks for coming today, and thank you to the programs team at the IA for having me. This is Bernie Sanders. Bernie Sanders is Senator of Vermont. He's pretty sound on a few things. He's okay with drug reform. He's okay with criminal detention reform and things like that. Unfortunately, Bernie Sanders has also said on the record that he thinks that bread lines in countries like Venezuela are a good thing because it shows a kind and caring state. So let's not take anything he says too seriously. But Bernie Sanders wrote an op-ed for the New York Times about 2 weeks ago, praising someone very similar to him over in the UK, Jeremy Corbyn. And Bernie Sanders wrote this op-ed saying, well, essentially that Jeremy Corbyn won. He was a bit mistaken on that, but he did have a very good point. He said, look at how successful Corbyn has been in the UK, much more successful than we expected, with promoting some very socialist policies. And one of the ones that he flagged up in particular was healthcare. He said, so many Americans are burdened with expensive health insurance or don't have health care at all. Look at the UK, where they have a single payer system. The one that Jeremy Corbyn's promoting would put more money into. Let's emulate that. And he's pretty popular on this point. Polls over in America suggest that at least a plurality of people support a single-payer healthcare system. And I think a lot of that has to do with the fact that there's this insular bubble of conversation going back and forth between the US and the UK. In the US, I actually think it's a bit calmer. It's, well, we have a very expensive healthcare system. Insurance is not cheap. It's true, some people don't have quality access to healthcare. Look over in the UK, this idealist utopia where everyone has access to free healthcare. Everyone, 100%. And then over in the UK, a lot of people tell themselves, we do have the best healthcare system in the world. Yes, US is exactly what you should be wanting yourself. So they go back and forth, and they go back and forth, and they perpetuate this terrible myth that the only two options out there, there we go, are the NHS versus the United States of America. Listen to any debate in the UK about reforming healthcare, and all you will hear those who are pro-NHS say is, look at the United States, look at the United States. But this is a deeply unfair comparison, not just because the US is as far from a single-payer system as you can essentially get, but more importantly, almost every single developed country in the world has universal access to healthcare. Far from being unique in this perspective, the NHS is exactly the same as everyone else. A lot of countries around the world looked at the formulation of the NHS and they thought, well, that's a fantastic idea, access for all, but what a terrible system. Because where the NHS is unique isn't on the point of universal access to healthcare, it's on the fact that no other country outside of the shores of the UK has adopted an NHS-style system. Why is this? Why is it that other countries rely on social health insurance systems, where the government funds everyone to have access to health insurance, but lets the private sector run it? Why is it that in the Scandinavian countries there's a heavy focus on charity, where again, there's still some government subsidies, but there's no direct input of government running these kinds of organizations, running the hospitals in charge of the doctors? And I think the answer overwhelmingly is obvious when you look at all of the data we have out there on the NHS. Take your pick. Take the OECD to start, which doesn't actually ever come out and say that there's one particularly good kind of healthcare system. They separate themselves from that debate entirely. And they just say, if we're going to compare systems like for like, single-payer system to single-payer system, social health insurance system to social health insurance system, who's doing well? And when the OECD compares the UK to other similar countries like Norway and New Zealand, the UK ranks below average. And the reason that it ranks below average, even within somewhat similar systems, is because there's absolutely no competition in that internal marketplace. Look at the World Health Organization. The last time that they calculated how well the UK was doing, they ranked it 18th in the world, behind countries like France, Switzerland, Luxembourg, Monaco, many, many other European countries, Singapore, certainly over in Asia, and Hong Kong. It didn't come out best. It was not anywhere close to being the envy of the world. The European Health Consumer Index, published in 2015, was much harder on the NHS, really flagging up some of its inconsistencies. They ranked the UK 14th out of 35 and highlighted how inadequate it was in very important areas, including waiting times and denying patients access to drugs. At the IAA, our head of health and welfare, Dr. Christian Niemitz, has done a fantastic job of bringing a lot of these international comparisons together. And he found that overall, when you look at every comparison out there, the UK almost always ranks in the bottom third, on par with the Czech Republic and Slovenia. It is never in the same category as Switzerland or Belgium or Germany or France. But then there's the one outlier, and it's probably the one you've heard of because it's the one that everyone loves to cite if they're trying to defend the NHS, and that's the Commonwealth Fund study. And in 2014, I believe it was, the Commonwealth Fund study found that the UK ranked best out of 11 countries with very different kinds of systems. Number 1, and the US came in 11th, and it was just hailed as why the NHS is indeed the envy of the world and exactly what everyone else should be pursuing. So how is this possible? How is it possible that when it comes so badly, the NHS and all these other rankings, when we see from Christian's work that thousands upon thousands of lives could be saved every year if people were simply being treated under different systems, how is it possible that the Commonwealth Fund study came up with a completely different outcome? And the reason is that the Commonwealth Fund study measures inputs. It doesn't measure outputs. So the questions asked in the Commonwealth Fund study and the questions that they were pursuing had a lot to do with the processes within the NHS. So a typical question was something like, physicians reporting it easy to print out a list of patients due or overdue for tests or preventative care. That's an input. How easy was it to print out a list in the system that you operate under? And there the NHS scores very well. It turns out that the NHS is pretty decent when it comes to those kinds of efficiencies. But in the entirety of the study, there was only one question asked about patient outcomes. The only question asked about how patients fared once they went through that system was this: hospitalized patients reporting infection in hospital or shortly after. And on the one question that cared about you, the patient, the outcome, the NHS ranked 10th out of 11. So it was not the case that this was the best system for patients and for getting the best outcomes when it comes to very serious things like cancer and strokes and heart attacks, but it was efficient on the input side. Now that's a fine way to measure a healthcare system. That's absolutely fine. It's actually an interesting finding. But we have to be honest about what we're really measuring when we use the Commonwealth Fund study to try to justify the structure of the NHS. Once it was published and going around in the media, The Guardian did a write-up of the findings, and obviously it was just glowing and thrilled that the NHS was the best healthcare system in the world. And without any irony, they wrote up the study and actually, I think, accidentally summed it up the best I've ever seen the NHS summed up, which was that the only serious black mark against the NHS was its poor record on keeping people alive. So when it comes to the facts and the figures around the NHS, even from the Commonwealth Fund, but certainly from all the other studies that make it appear to be pretty average to mediocre, I find that the findings are quite persuasive. Countries that are embracing other kinds of systems that have more competition, that have a free market aspect to them, but certainly also do have that safety net of government funding to make sure that no matter how poor you are, you can still access that health care, come out on top. They come out the winners. But unfortunately, this conversation is simply not had in the UK. You will not find many politicians or journalists or pundits across the board who are willing to talk about the very stark reality that the NHS is in crisis. And the main reason that it's in crisis is because the fundamental structure for 70 million people just doesn't work. Without that competition element, the efficiencies aren't there, and waiting lists grow, and mistakes are made, and patients suffer. But I find that there are two arguments in particular, even when all of this evidence is put forward, that the pro-NHS, envy of the world, sacred cow lobby still struggle with. And that's the issues of privatization and profit. Present all the facts you like, but people will still say, you want to privatize our NHS. To which I would say, what do you mean by privatization? Genuinely, that word has become a fear-mongering word. It's been butchered. Do you think Germany has a private system? Do you think Switzerland has a private system? I mean, overwhelmingly, the answer is no. It clearly isn't private in the way that we think of the United States, which I would also say is not nearly a free market system whatsoever. It's a monopoly of insurance companies who are in bed with government being propped up and allowed to operate at sky-high prices. But none of this is privatization. If we look at places like Germany and Switzerland, they have a very strong sense of the government being involved to make sure that nobody's being left behind. But yes, they are embracing the market. They are embracing the market, and it's creating some great results. The other frustrating thing is this issue of profit motive. Nobody should be able to profit off of someone else being ill. But if that really is your line, you're in a tough spot, because once money's involved, someone's always profiting. Someone's always going to profit off of that money. Take the junior doctor strike. People were out in the streets not showing up to work saying, you have to raise my salary in order for me to go back into that building and do my job. Now, I actually happen to think that junior doctors should be paid more. And under other systems, like in Australia and throughout Europe, they are paid more. And they have a more flexible working environment, and they're happier on average. Of course, that comes down to the system that they're functioning in. Another system isn't just better for patients, it's better for doctors too. So I think they should be paid more. But if you have a monopoly, a state-run monopoly, and doctors are supposed to be public servants, it seems a bit shocking to me that you would go on strike in order to ask for your pay to go up. But this is profit. Somebody is profiting when more money is put into the NHS. So when it comes to profit and when it comes to money, my question is, who is profiting and who is supposed to be profiting? Is more money going into the NHS actually improving those waiting times because the evidence isn't there? Is more money being funneled in actually a profit for the taxpayer who theoretically owns the NHS? Or is it going to the bureaucrats and going to the doctors who sure do deserve it, but this is still not the system that we want to be perpetuating because it doesn't have the profit for the most amount of people. It's not maximizing that profit. Whereas in countries like Switzerland and Germany, everyone is profiting from the amount of money being put in and also from the system, that market system, that's allowing for better outcomes. So I think I've got about 10, 15 minutes for questions, but I would just sum up by saying that I don't really care what you call the NHS. You can call it a deity, you can call it a national health service, you can call it Bob. And I think it's absolutely fine to take pride in the fact that many years ago the UK decided that universal access to healthcare was a right, and that people, regardless of how much they earn, should be able to have it. But it's also important to realize, to look outside of the United States and the United Kingdom, and to realize that almost every other country has also done this. It's not special anymore. And if the NHS were to remain special, and were to remain something that's actually helping people in the UK, then it needs to adapt. And it's going to need to start looking to its neighbors, and it's going to need to start looking towards Asia to figure out how to make those advancements to make it work in the 21st century. So, thanks for listening. I'd love to take some questions.